So shifting gears. So yesterday around this time, Dina and I spoke on what's going on right now in our emergency rooms, and Toronto General still has the bed alert in terms of capacity and staffing issues. That's still going on. Mm-hmm. So it struck a bit of a chord. So we want to continue this because we did mention that Doug Ford was going to speak yesterday in Stratford, Ontario. He did. He took his first questions on this topic since it really blew up. And here's what he said in terms of, we didn't hear much of a plan, but here's where he went with it.
Coast, regardless of their partisan stripe, continues to urge the federal government to come to the table and talk about increasing health care funding over the last couple of years. And this just didn't happen yesterday. It didn't happen a week before, and it's not unique to Ontario. It's happening across the entire country. It's, a matter of fact, happening across the world right now.
Also in that, he said nearly 90% of the pre-pandemic rates are being dealt with. 9 out of 10 people going to emergency are being dealt with. He also said with a straight face, the average wait time is only 8 hours. So Devo, we had a run at this yesterday. Your take on all this?
The average wait time is only 8 hours. Is that a full workday? 8 hours? So
for a lot of people.
Some people it's 20 hours.
Yeah, but I'm saying that 8 hours. That's a work day, right?
Yes.
What are you at the end of that work day? Exhausted.
Yeah.
And you're not in pain. Like that's ridiculous. And to say that it's not a problem, or it is a problem everywhere else in the world. It's not what we're seeing here. You know, I have friends that work. My brother works, out west. It's not the same situation we're seeing here in Ontario. I have a friend of mine that works in the ER, and he just tells me he's constantly being pulled in every direction, tries to do every shift in order to help out. He's a doctor, and he's like, dude, I'm burnt out.
Yeah.
I am burnt out, and I'm seeing it on the front lines with the people that he works with that they can't take it. So you need some sort of incentive or something to help people stay in this workforce because they are not feeling appreciated in any way from sometimes patients, from obviously the government. You got to do something to make them feel like they want to be there to help all of us. That's what they got into it in the first place for.
And to that end, the shortage is only going to get worse because the new statistics showed that 50% of registered practical nurses in Ontario right now are considering leaving the profession because they're so burnt out. They literally can't do it anymore. I don't even know if money would help. When you're burnt out, you're burnt out. It's a physical, mental exhaustion. So we're looking at the problem getting even worse. And he seemed a little bit casual to me yesterday in addressing that. It's sort of happening all over the world.
He's blaming everybody else. Let's go talk to the federal. Bro, you're running this province. Run the province.
Now, in his defense, there are no talks right now between the feds and the provinces. That's my beef with True. Like, I know a lot of people in some of the posts yesterday were saying it's a provincial issue. If it's a national emergency, it's the same crap I heard when the convoy's sitting there making sure people didn't sleep in Ottawa. The federal government's saying, no, it's not our jurisdiction. At some point, the country's your jurisdiction. Don't give me that stuff. That's ridiculous. And also, 76% of people in that poll, in terms of nurses, say they don't have what it takes to care for people properly right now. Yes. They do not. Now, in terms of money, Doug Ford did once again say the $5,000 bonus to nurses and frontline healthcare workers, he called it a thank you bonus, is there. He was very proud of that. He didn't want to address Bill 124, which caps raises for nurses and frontline healthcare workers. But you're right, there is a kicking the can mentality to this, Devo, that I heard yesterday that really concerns me. And there is no plan. I'm hearing the same bullet points I heard during the campaign. Campaign's over. Time to govern. This is time to govern. And I was really concerned with that. Final thought to you before we move on.
People are scared to be hurt right now. People are scared, like everything. Look, I go in to play sports. I'm like, nope. I'm just trying to be, I don't want to go there. That's the last thing you want to do right now and I mean, it's not the first thing you ever want to do anyways. But people are scared to go there because they don't know if they're going to get the treatment they need. And that's unfortunate because you have people that are working their tails off that want to give you the treatment that you need. And they just physically can't do it. So
agree with all that. Devo, appreciate it. All right, let us shift gears here. It is what we do. Sometimes it's awkward on my end. Forgive me if it is a little bit. But making people happy is never awkward, Devo. And I think we need it now more than ever.
That's what we try to do, man. That's what we're going to do today.